Hello and welcome to VIA's webinar on responding to COVID-19, how agencies can optimize transit resources during emergencies. My name is Dan Berkovits and I'm a director of strategy at VIA, a company that uses innovative technology and approaches to help improve public mobility around the world. We appreciate your taking the time to learn about how agencies can support crisis response in the face of the COVID-19 pandemic, and we hope that wherever you are, you're safe and healthy. In this webinar, we're going to talk about the different sorts of mobility challenges that communities are facing during the COVID-19 crisis and what that means for transportation agencies, so the impact that's having on transit ridership and transit operations for agencies that are responsible for providing mobility around the world. And we're going to look at how agencies can respond to those challenges by providing different types of solutions, by temporarily redesigning their networks in response to the crisis, by developing solutions to help get healthcare workers and other essential workers to their job sites. And that doesn't just include healthcare workers, it also includes utility workers, people who work in essential businesses like grocery stores and pharmacies, and any other stores that have been designated as essential to stay open during this period. And finally, also by delivering goods and services to people who may be staying at home now. We're also going to talk through some specific examples from around the world to demonstrate how different agencies have been tackling these issues and either adapting existing services or launching new services to help address the COVID-19 crisis. As you all know very well, this is an unprecedented time of crisis. COVID is spreading rapidly across the world. It's been detected on every continent, and the scale of the crisis appears to be increasing daily. And what this means is different in every location and in every context. The crisis is being managed in different ways in different places, but in much of the world, some form of social distancing has been implemented. And this is important for everyone because COVID-19 can impact anyone, but it's especially important that we follow these practices to protect seniors and other at-risk populations. This has meant that restaurants, bars, and other non-essential businesses, retail, have all been closed, or in some cases are operating under some pretty strict limitations, and people are working from home where possible. So, in total, this means that there are far fewer people on the streets, there are far fewer people moving around our communities, and this has had a real impact on transit agencies and how they operate and what their mission should be at this time. So under the best of circumstances, transit agencies play a really critical role in getting people to their jobs and getting people to places of recreation, to helping them access critical services, really just in linking people to opportunity. And this role is shifting right now in the midst of this crisis, and agencies are grappling with what that means for them and what they can do with the resources that they have at hand, how they can adapt their fixed routes, and just in general, how they can address a constantly changing situation and be as positively impactful as possible. So the good news is that people are actually really following social distancing measures, that people are cooperating to help stop the spread of COVID by staying home. But this does mean that transit ridership is really shrinking dramatically, very, very dramatically. We're headquartered in New York, and I know that ridership, MTA ridership has fallen by, I think, at least 75%. So, it's an extraordinary decrease in daily ridership. And at the same time, some operators and other staff may be getting sick and maybe staying home as they recuperate from illness or quarantine. So how should agencies react to this? Well, agencies are reacting differently in different parts of the world. Some agencies are attempting to provide typical levels of service, but are coping with driver shortages because of those reasons that we just discussed. And many others are planning to or already have cut service, but are thinking about which routes should they retain and which routes should be eliminated, or how should schedules be adjusted. And when they do decide to cut service, in many cases, they now have surplus vehicles and operators who are not working. So they're thinking about, how do they deploy those resources or use them, hopefully in a positive way. Meanwhile, essential workers still need to get to work. It's really critical that they get to work. And this includes doctors and nurses and other healthcare workers, but also the people who operate our critical utilities and public services, government workers, and the people who are on the front lines and working in grocery stores and pharmacies and supplying people with the basic things that they need to live. Everyone needs to access those basic goods and services, but access is especially challenging potentially for the most vulnerable in our communities. Lower income families may not have access to a vehicle and may have already been relying upon public transportation, which agencies are thinking about potentially adjusting. Some students rely upon the public school system for some meals, for lunch or other meals. And while school systems are still often providing those meals, the families may need to think about, well, how and where do they need to go to pick them up, and how are they going to make that happen during the crisis. And other people rely upon food banks, and many seniors rely upon senior centers and community centers for things as well. And all sorts of other people rely upon other critical social services that they'll need to continue to access during this time. So in these extraordinarily difficult times, these unprecedented times, transit agencies are facing challenges, but may have an opportunity to actually solve several problems by using the vehicles and operators that have been freed up through service reductions, potentially to help get those essential workers where they need to go, when they need to be there, and also to help the general public and vulnerable populations to access food and other critical supplies, either by taking them to those places where they can pick up those goods and supplies, or by bringing the goods and supplies to them. The needs of every community are going to be different, and even a single city or community may have different needs at different times, of the crisis, or even in different places within their city or their community. So it's really important to think about designing solutions that are tailored to the specific needs of the community in question. Time is key. And so it's really critical that the transit agencies develop solutions quickly over the coming weeks, because as lockdown measures and shutdown measures are implemented, the landscape for them in terms of the ridership is going to shift incredibly rapidly. The needs of their healthcare communities and other communities are going to be shifting really rapidly. And what happens now in terms of the crisis response will be incredibly impactful. And so the role that transit agencies choose to play in that crisis response is going to be very important. And we've seen that agencies around the world are acting in different ways. And so the following case studies are examples of different transit agencies and governments that have reached out to us at VIA to help them respond to address those challenges associated with the COVID-19 crisis, either by adapting existing services or by launching new services in different ways, as you'll see. So some agencies may choose to rapidly adjust their networks to respond to the crisis. And that could include adjusting their fixed routes, potentially even introducing new fixed routes to make sure that they serve critical locations, so those hospitals, those food banks, and other critical locations. But in some cases where they're seeing demand drop off, by reducing service, by rethinking schedules and frequency, which may free up certain resources. So one example is the Central Ohio Transit Authority, or COTA, which is headquartered in Columbus, Ohio. And they are currently working with VIA to analyze how they can redesign their network dynamically and engage their resources and apply innovative tools and approaches to help support essential workers and the general public during this crisis. So along with VIA, COTA is evaluating ridership right now, ridership over the last couple of weeks, to identify which routes should be temporarily limited, where there are opportunities to dynamically reroute fixed routes to serve critical locations, and to think about what the impact of service reductions will be in terms of resources, and how they can then use those resources to provide new forms of service that will help to support those essential workers and also support the general public. They're also implementing on all of their services regulations that will limit the number of people per vehicle to comply with social distancing policies. And so through thinking critically about which routes make sense to continue serving and at what levels, COTA may free up resources that can be used to operate a technology-enabled on-demand or pre-scheduled service to transport essential workers potentially to their job sites, and to transport the general public to grocery stores, to pharmacies, and even potentially to deliver food and other critical supplies to people around the region. So this effort will take place over a period of about 2 weeks, but the time frame for planning, designing, and launching emergency services will vary dramatically depending on what's in place at present and the specific context, as you'll see as we walk through some examples now from around the rest of the world. So in Germany, Berlin's transit agency, BVG, is extending the service zone of their VIA-powered service called the Berkovits to cover over 10 hospitals. So they're transforming an existing on-demand service in this case that already covered a good chunk of the city into a dynamic service that will serve a larger area and will be focused on providing support for essential healthcare workers. And to that end, registration is going to be limited to pre-approved workers who meet the classification of an essential worker. And at the same time, vehicle capacity will be limited to promote social distancing rules. So the timeline in this case to launch the service was about 1 week. This extended service was about 1 week, and it has already had a tremendously positive response. In Malta, as in other places around the world, social distancing has led to challenges in helping people access the goods and services they need. And so Cool, which is a VIA-powered service, has been extended to provide coverage across the entire island of Malta, while simultaneously limiting the number of passengers per vehicle. Cool is a shared service, but they'll be limiting rides now to private rides in order to promote goals of social distancing. And in addition, a totally new function has been introduced, which will permit grocery stores and small businesses and other essential businesses that didn't necessarily have a delivery capability in the past to now use the Cool app to deliver goods and services to people who are staying at home to help promote goals of social distancing and reducing the spread of COVID-19. And that service is already in action. The app will also provide a distinction for drivers between a delivery request and a ride request so that they know when they're driving to a pickup, whether they're picking up a passenger or goods for delivery. And the timeline to launch this was just 2 days because the solution really leveraged features that were already present in the existing service. In the United States, an Ivy League university partner is temporarily replacing their fixed route shuttle service with a VIA-powered on-demand service that is usually only operated during evening hours. So it's an on-demand evening shuttle, and typically they have a fixed route shuttle service during the day, but they're shifting to on-demand service all day long. And they're reducing the capacity of their vehicles by 50% as well to promote those goals of social distancing. So the goal here is really that in a period where there's an expectation that demand will drop off dramatically, and they've seen demand dropping off dramatically, continuing to provide service to riders who still need access to essential goods and essential services, while providing additional flexibility and utility to the riders who are continuing to use the service. And the university rapidly communicated this change to riders so that they knew that they would be able to request rides on demand during the daytime. And the conversion to an all-day on-demand service was carried out in less than 24 hours. In New Zealand, the MyWay on-demand service was planned to launch on April 20th, so in about a month in Timaru. But because of COVID-19, VIA worked with Environment Canterbury in New Zealand to accelerate the launch and to temporarily transform the service to provide transportation for access to essential goods and services only, filling a gap that was created by a reduction, actually an elimination of fixed route service in this community. So the MyWay service will be available earlier than expected and will be providing flexible and useful on-demand service to access grocery stores and pharmacies, to get people to medical appointments or other essential services. And the vehicle capacity will be temporarily reduced, as was the case in many of the other examples that we discussed, to promote social distancing and help to stop the spread of COVID-19 in this community. In addition to those case studies that we just discussed, VIA has been talking with partners around the world about different ways to expand or introduce on-demand services to provide transportation for essential workers and connections for the general public to access critical goods and services during this time, including 3 major cities in France. And we're prepared to work rapidly with our partners to either introduce new services or modify and expand existing services to meet the mobility challenges that are being introduced by this crisis. Typically, most of the time, VIA works to develop shared on-demand solutions that are tailored to meet the needs of our partners. And the types of needs that we might typically be addressing are things like first and last mile connections to fixed route transit, or providing a useful service in less dense areas that may not be well served or maybe are not efficiently served by fixed routes, or by optimizing paratransit and school transportation. But in these times, we're working with our partners to rapidly and efficiently develop services that are both safe and designed to meet the unique transportation challenges of the COVID-19 epidemic. So we can work with you to understand your particular needs and during this time, and to address them in a way that allows you to use your underutilized resources and provide your community with safe and useful transportation in different ways. And we can comply, as was the case in all the case studies we discussed, with social distancing requirements, and work with agencies to identify best practices for sanitizing and maintaining vehicles to help support the safety of riders as well as drivers and other employees. And we can streamline all of these pieces into a single platform, and we can either adapt an existing service and platform to provide those services, or we can develop a new one. And in either case, really within a matter of days, in reaction to the urgency of the crisis situation. These are incredibly challenging times, and transit agencies and other mobility providers have an incredibly important role to play. Together, we can work to develop solutions that leverage the resources that agencies have to make sure that essential workers can get to their jobs safely without putting other people at risk, to provide the most vulnerable populations in our communities with reliable access to food, to medicine, and to other critical supplies. And in doing this, really, it'll lay the groundwork for a crisis response strategy that will serve you into the future. So we would appreciate the opportunity to work closely with you to think about how you can optimize the resources that you do have to be an important part of the crisis response in your community. If you aren't familiar with VIA, we have been providing technology-enabled technology and operational expertise for mobility providers for 8 years, with a focus on developing dynamic, on-demand solutions. We've had an opportunity to apply our technology and operational experience with a broad range of partners, including transit agencies, universities, companies, and others, in an incredibly broad range of environments, from small towns and rural areas to the world's biggest cities like New York and London and Amsterdam and Tokyo, on a broad range of use cases, including public transit, paratransit, and school transportation. In every instance, we work to develop services that are customized to meet the needs of our partners and the communities that we serve. Thank you for taking the time to participate in this webinar, and best wishes in this difficult time.